asking him some important questions today. Hello, Dr. Brown, how are you?
Doing good. How about yourself?
Good, thank you. So I've had a couple of people ask me, when do you see your family doctor and when do you see a nephrologist? So can you tell us, first of all, what's the difference between those two doctors?
Okay, I think that's an excellent question and one that a number of people may be wondering about. So let me start out by saying that your PCP, or primary care provider, or primary care physician, is a person that takes care of the whole person. The medical specialties that make up what we call PCPs are typically internal medicine, and there's also what we call family medicine. There's also pediatrician, but pediatrician typically is for kids. The family practitioners, they take care of people that from all ages, from birth basically to death. Internal medicine physicians are basically what pediatricians are to kids. So the internal medicine physician will take care of adults, typically anywhere from 16 to 18 and up, and the pediatricians will take care of the younger ones. And what they do is they take care of everything. So you got a cold, you go there. You got need a checkup, you go there. Now what happens is that when the primary care physician, and that could also be a nurse practitioner or a physician assistant, if they find something wrong with the kidneys, could be that the person is having blood in the urine, or that they draw labs and see that the kidney function is not what it needs to be, then they send that person to a specialist. And that specialist is a nephrologist who specializes in kidney disease. And so the specialist kind of takes over for the primary care provider for that specific need. So they, for the most part, won't check the cholesterol. They won't manage the diabetes, but they will manage the kidney disease. Now, these other aspects do impact the kidney, but typically what happens is that the nephrologist or the specialist will identify other things that need to be taken care of in order to protect that kidney. So in a nutshell, that's kind of the difference. So the specialist kind of focuses on whatever their specialty is, in this case nephrology, and then the primary care provider or primary care clinician will take care of everything else. A lot of specialists require that a person have a primary care provider before they can come into that clinic to be seen.
So because the nephrologist would not be able to take care of you if you got the flu or if you had a sinus infection, so you need that collaboration between the two, the specialist and the primary care doctor, so that your entire health can be taken care of. Where you need the specialist for your kidney disease, that's taken care of by the nephrologist. So
exactly.
It's a good relationship that needs to exist between the two physicians.
Exactly. So it is a relationship. So it is, each person doing their part to make that person a healthier person.
Okay. So I hope that answered that question. In another video, we're going to be talking about who makes up the entire medical team when you do have kidney disease, and I think that'll be helpful too for everybody to understand who plays what role in the clinic when you go to see your kidney doctor.
I think you're right.
All right. Well, I think I'm going to hand it back to Dr. Brown to finish up, and then we'll be back soon with another video.
Okay. I'd just like to tell everyone that on thedocbrown.com, I'm a doctor, but I'm not necessarily your doctor. So I do encourage you to talk with your physician, your nurse practitioner, or your physician assistant about any specific medical needs, but always come to thedocbrown.com to expand your knowledge about different disease states. Thank you very much for checking in, and we'll see you at the next video.
Thank you.